Okay, we can move again. Hey, we're live. Welcome back to the Coding Cheerleader Solution. It's been a long 2 weeks, and we are glad to be back. Because now, since you voluntarily chosen to be here, the torture begins. And the torture begins with auditing. So, auditing is different for every people. Meaning, Caitlin, I'm talking earlier that everybody has a different definition, but auditing involves, in my opinion, quality control aspects of building coding. So, generally speaking, these kinds of roles usually take a very focused attention and an inquisitive nature. There's many different types of auditing. It's almost as much as there is coding because every kind of coding has to be audited by somebody or usually is audited by somebody. So tonight, to talk about some of these different aspects, we have two panels. We have Caitlin Brack. You put up your little banner, who is a medical coding auditor and educator at Baptist Health Deaconess in Madisonville, Kentucky. And we have Miss Leslie Bowles, who is a co-owner and president of Review Healthcare, as well as an instructor at the prestigious Rutgers University Continuing Education Program. And then you have me, who just finally learned out how to spell HIPAA. I actually have it on my shirt, so I can, remember how to spell it and not get yelled at by Victoria Mole. Yeah. Mm-hmm. She will call you out on that. All right, so moving on. So let's get into auditing because there's a lot of content. Let's start with Leslie. What is your opinion of, what is your definition of auditing and what is the purpose behind it?
So my definition is multifaceted, right? I believe auditing, especially with my compliance background, I believe auditing has sort of a regulatory component to it, right? I also believe it has a revenue integrity component to it. I believe it's a safeguard. I believe it is best business practice. I believe every organization should be doing it, no matter how small or large you are. And I also believe that auditing is necessary. That's why I've said it's multifaceted for me.
How about you, Kayla? What's your take on auditing?
I agree with Leslie. Something that I think about when I'm trying to. I think it's hard. I think it's hard to actually define auditing because it's so many things. It's to me, auditing is an actual assessment. We're talking within healthcare. That's our primary purpose here. It's an assessment on where your risks are. It's depending on when you're performing that audit. If you're doing a preliminary, you're trying to prevent those. You're trying to prevent from someone else finding those problem areas. You're trying to identify themselves before and correct them, versus auditing on retroactively. There's something you're looking for. That purpose is different. You're trying to find, okay, this has flagged somebody. Why is it flagging somebody? Why did what have we missed in our in our before audits, before things go out, before someone else caused something else? What's flagging someone else to look into us? So I think your purpose is going to depend on when you're performing that audit. Is it because someone else is concerned about something, if they're concerned about one of your practices, or if you're just compliance, regulatory, hey, we're just going to make sure everybody's doing what they're supposed to do, and if somebody's not, why are they not doing it? That's kind of my take on it.
All right. So is there any difference between coding and auditing? Like, what are the minor differences? Let's go use Leslie again.
I'm so glad you asked this question because there is a difference between coding and auditing. So coding is the act of appending or reporting a code for services that is performed. And I think it's important for people to differentiate between operational and oversight, right? Coding falls under the operational aspect in which you're performing that function for the purpose of bringing reimbursement in, right? It's not that we don't follow the same sort of rules and regulations and all of the guidelines that we have, but it has a distinct purpose. Auditing is what I like to call a regulatory function. It's oversight. It's to ensure that what you have coded operationally is correct. And one of the things that, really gets me going in the world of coding is that everyone always assumes that if you're a good coder, you're a great auditor. And if you're a great auditor, you're a great coder. And that's not the case. So a lot of organizations, I hope I'm not jumping ahead here, a lot of organizations make the mistake of sort of creating like this one man band, right? Where they think they can stretch them in both directions without really giving them the necessary tools to be successful. And I think it's really, really important, especially for those who are listening today on this call and you work in a healthcare system, a small practice, an ambulatory surgical center. I know we're all trying to save money, but it's really important to identify those distinct differences and then also assess whether the individual you have engaged or hired can actually perform both of them successfully. So I'm glad you asked that question.
Okay, well, what's your take on that?
I think coding, you have to have some understanding of auditing to code. I think, at base level, like coding, you have to do some some auditing. You have to make sure the documentation components there. You have to make sure again the code is correct. So whenever I was in production coding, I would get the chart after it was, after the provider completed it, they dropped their orders and things of that sort. And in coding, I had edits and warnings prompting me on what to look at. Auditing, you have to already know those things. So it's one of those things you have to have coded first, in my opinion, to audit. You have to already know what those things are, especially, for me, I have experience auditing coders and providers. So when I was auditing coders, I was looking at, okay, those edits and warnings popped up. Did they hit those? Do they understand what those warnings mean? Do they understand what they're supposed to do as part of their process? When I'm auditing, when I'm having to audit when I'm auditing providers, I'm making sure that their documentation is accurate, but all of that is needed in order to code and audit correctly. So I think, again, coding is, do you understand what you're supposed to be doing when those things hit? Auditing is, do you already know those things? And, it, and this is probably going to be discussed a little bit farther down, but when you're in that auditing role, it's easy to forget all of those coding things, especially if you're not in it anymore. Because I know sometimes I have to think back on myself. I'm like, okay, I used to have triggers for this, and this. I don't have that anymore. What do I need to remember in order to make sure I'm auditing compliantly on both sides of it?
All right. So let's talk about your daily routine. Let's talk about like the micros, like the micro part of it. So what are the typical functions of an auditor, and what do you do on a daily basis? And I'll start with you, Caitlin, because you are a current production auditor. So let's start there.
Yes. So I will share that I've recently started auditing with Norwood part-time. And so auditing for them has been different. This has been a different experience than auditing somewhere else. I will say they have a very good training setup. And so like, I'll be honest, I wasn't used to having macros when I audited. And so they have, I think having templated responses that already explain the, that explain the guidelines so everything is uniform and everybody understands it the same way. That has been super helpful in, whenever I was learning their processes. But so at at Norwood, they already give me the charts to audit, and I audit all of the E&Ms, and then I audit all the diagnosis codes attached. Mm-hmm. When I'm in my other auditing role, I'm running reports and I'm finding the charts to audit. And when I'm doing those main compliance audits, we're only auditing primary diagnosis versus, at Norwood, I'm auditing all of them. And I think that there's, you have to take both of those into considerations because everybody's compliance audit is different. Some will audit based off of what's being attached onto the claim form. some will audit based off of, they put the focus on that primary, and then that that piece in itself is its own, that's its own thing. And then you add into, okay, how am I going to score these providers? How do I know, how am I going to be able to quantify if a provider passes? And so a lot of places that is already built. They have that structure in place. And so a lot of that is, is learning how each organization operates, as far as how their providers, how their audits are started, what the work is required of you versus what's already been done, what's already been completed for you. So I'd say my two auditing roles are different at both places that I work at. So I think that's important to keep in mind with my context.
Okay. Now, Leslie, you work as an outside consultant, not within a health system. Do you see it a little differently? Like, what is your routine from the outside of that group?
Yeah, it is a little bit different from what Caitlin had mentioned. One of the things we cater our audits and we target our audits to our clients' needs, right? So it depends on what the need is and the audit focus. So for us, a lot of what I do from day to day, especially as the CEO of the company and in conjunction with my partner, what we're looking at is assessing the skill sets of the auditors for our clients' needs, right? And so I think we have to think, sometimes we have to think proactively. Sometimes our clients come to us and they know exactly what they need. Sometimes they don't, right? And it requires us to assist them. So we've kind of created sort of, I call it this menu of different types of audits that may be relevant to what their needs are and what they have going on. But I can tell you, I worked in a hospital setting, very similar to you, Caitlin, for 12 years. Prior to venturing out and starting my own business. I started out in the compliance department, and then I took my auditing skills to private equity, which was a great experience for me, because what it did, it taught me how to expand the auditing scope. Because I think a lot of times when we work in the same type of environment, our scope becomes a little limited, right? In the way in which we audit and the type of services we audited. So I had the great privilege of being exposed to auditing both in, inpatient, outpatient, but also from a diligence standpoint, also from clinical validation standpoint, a medical necessity standpoint, CDI. And so auditing is, I think I really enjoy auditing. I call myself nosy by nature. I have a very investigative personality, always have had one. And I think as an auditor, no matter what setting you are, you have the ability to sort of create, I like to call it your own Wonka land when it comes to auditing, and be really, really innovative in what you're looking at and how you're identifying risk, and then finding proactive ways to mitigate that risk. So it really depends, right? It depends on where you're working, depends on the setting, it depends on the role that you have, and it really depends on the needs and the risk.
Okay. So let's talk even about more minutiae. So, Caitlin, when you come into your office or your computer station, like, what typically do you do from clocking in to clocking out? Because one of the things is that we talk about auditing. If you've never actually done it, it's like an abstract idea. It's like, what do you do on a daily basis? What is your main headache for 8 hours?
I'd say, so my primary background has been in family practice. Those of you who've talked with me in the past, this already. I think part of one of the hardest parts is there's so many ways that some of the guidelines can be interpreted, and I think coming on an agreement of what those guidelines mean. Sometimes if there's not a whole lot of a lot of additional guidance that comes out, I think that can be one of the biggest headaches. I was on an exam committee for the Evaluation and Management Certification exam at APC, and I remember one of the questions we had talked significantly on what a guideline meant, because it was a diagnosis, and it was one of those things where the guideline and the code descriptor itself seemed to not really align with each other. And so we had several conversations of, okay, what does this guideline mean? Can we find a coding clinic on it? Can we find, is there something that somebody has out there, a Mac, somebody that can give clarification to this? And I think again, the most difficult part is making sure everyone understands guidelines, and especially when you're trying to communicate those findings to a provider. A lot of providers get mixed up on when to bill a level 3 versus a level 4, and so it's okay. Give me a common problem that you treat. Okay, talk me through give me examples of a patient that you consider low complexity. What's straightforward to you? When does it get moderate? Okay, let's talk about how we can document those things to make sure that it comes across the right way. And I think sometimes it's just having those conversations, trying to explain the guidelines to providers as well. So I mean, coder to coder, auditor to auditor, we have our own issues trying to understand guidelines at times. When you go auditor to provider, that's not how they're taught. I'm sure, Leslie, you can probably attest to, and you, John, too, history of written into documentation. Providers are taught to write, patient has history of diabetes mellitus. Okay, from a me standpoint, a documentation standpoint, I have to understand that this is no longer a problem. And they're like, well, that's how they taught us to document. And I'm sorry, you're going to have to unlearn that. That makes no sense. And this has been beaten in my head for years. We have to unlearn that. I think guidelines and understanding them and teaching them to others is the most difficult part of auditing. Probably that's a long-winded answer.
No, it's a great answer. John, if I could just add to that, to Caitlin's point about the guidelines, I think one of the most challenging things that I have experienced being an auditor is very similar to what Caitlin is saying, but then also managing auditors is teaching them when to back off, right? Because not everything has a definitive answer, right? Nor does it have a conclusion. And I think as auditors, one of the challenges, and it's something that you probably have heard when you were maybe studying for your CPMA or maybe a different auditing certification, but it's something you have to learn through experience, which is if there's not a regulation to support, what you are educating that provider on, or if there is no guideline to support it, then at that point, you're just speaking from the book of you and you need to back off. And so I think that is something that a lot of that was sort of embedded into my mind as a compliance specialist, right? We go by regulation. That's what we educate by. That's what we audit against. And coders have to be very careful of sort of creating their own mini guidelines within the guidelines. They have to stick to the black and white. And when it's gray, feeling confident enough to say, listen, this is a very gray area. And at this point, as an auditor role, you have to make an operational decision on which way you're going to manage this, right? It's left up to you. So I think that is a very difficult thing for a lot of people to actually, take on day to day.
All right, we have a question from the audience, and which rarely happens because LinkedIn does not like to share questions from the chat. But we have one here. So this is from Carlita Johnson. She asks, "Is auditing production like coding is production?"
Well, I'll speak to it from a auditing company standpoint. Auditing production is like coding production from the standpoint where you do have a quota that you are asked to perform against, right, per hour. I think one of the things that is different in some aspects to what we spoke about earlier is the complexity of it, right? I think when it comes to coding production, it becomes pretty standard and almost redundant, which is why you're starting to see more AI companies develop what they call redundant or automated coding processes for it. But auditing production, although it is a production factor to it, it does require a certain amount of knowledge and skill set. And one of the things that we do at Review when it comes to our auditors is we do assess whether you know where to go for the different Medicare administrative contractors that are out there. There are a ginormous amount of rules and regulations as it relate to coding guidelines, right? Those are basic. We all have to go through them. But then there's another layer that's not necessarily a component of anyone's coding certification exam that you have to, or auditor certification exam that needs to be assessed to see if you can pivot on a dime when it comes to understanding how to access and then interpret rules and regulations. That's a great question.
How about you, Caitlin? And do you have any kind of comparison between coding production versus auditing production?
So, as far as production, like I'm expected to document I'm coding production. So I write out how many so at Norwood I write out how many E&Ms I audit. I write out how many diagnosis codes I audit. And I'm still in the training process, so I'm not for sure exactly what their expectation is. I'm sure there is one documented. I'm just, at least I'm very early in my training there. But it's your auditing production and coding production is different in their functions. Again, you're like Leslie said earlier, you're auditing for act, you're auditing for correctness. Were things done appropriately? Was the codes, was everything coded appropriately? I feel like coding production is a little, you get into some specialties where it's almost like mind numbing. You don't have to think about it. You just, you know exactly what it's looking for. You do your thing and da 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 da. Da. I think auditing production takes a significant amount more of meticulous, looking at everything. And so the auditing production, you're not going to have a high as number auditing production as you will coding, because auditing takes way more. You're looking at way more things from an auditing standpoint. When you're auditing production versus coding production. Coding production, you're looking at what the edits and warnings are telling you to look at. Auditing, you're looking at everything as a whole. So production wise, yes, you have a production standard, but what's part of that production is completely different. Does that help at all?
Yeah, and I want to add into that because I audit on a daily basis, and one of the things that is different with auditing is we have two things that we consider. We have the scope, and we have this sampling, which is the amount of claims that we use to get our statistical average for the audit. So how many they got correct, how many they got wrong, it usually yields a percentage. So when you're doing an audit in a timely manner, you kind of want to have a reasonable audit sampling. That way you can complete the audit like you were completing your daily routine for coding. Like they have a set number. You try to want to get that done, as early as you can, because you don't want to audit somebody, say, in January and then complete their audit in June, because there's going to be so much changes educationally along the way that you're not going to get a decent score. So, again, it's about timeliness and I guess however large your sampling is, and also what's included in an audit. Because if you're auditing just E&M, you may only be looking at the E&M, like the actual CPT code, the E&M code, and diagnosis. But if you're auditing something that's more complex, like a major surgery, they might want to see the consent, the order, the diagnoses, the all of their documentation, in addition to the actual procedure note, those CPT codes, the diagnosis codes, any medications administered, and all of that. So it depends on what you're auditing. You might have a kind of different range of expectations in that way. But again, that is a little different for coding, because you do have to make sure that you are getting them done, but not in a single day.
So, John, I kind of wanted to bring a little bit of attention to this piece of it. So, my job at the hospital, I'm currently auditing denials. So, I'm looking at where our high where our high dollar denials are and whether or not they're legitimate. And I'm also creating education to providers based off based off of those denials that are legit. And so auditing denials, I do not have a productivity standard for, because there's a lot of research that goes into that. There's a lot of looking into policies, looking at documentation. It's hard to quantify, how quickly I should be reviewing said denials, because I'm looking at denials across every specialty. I don't do, so I think, I wanted to throw that out there too. So there's, I know we're primarily talking about coding and then, auditing providers and stuff like that, but auditing denials is also another piece of it. And so I wanted to throw that in also.
Okay. So here's a question to consider. When you're coding, you're typically coding for a provider. Is that the same with auditing? Are you usually auditing, for providers only, like you only code based on our documentation, or are there other people that you would audit for? Say, maybe you audit for a physical therapist or pharmacy, or maybe the billers. Like, what kinds of people could you audit? And this is mainly for Leslie, but are there different kind of functions within the organization that you would audit?
Yeah.
Or is it just a coding?
Well, absolutely. There's all sorts of functions for coding, right? Working in compliance, we audited everybody in all different ways and formats. But from a coding standpoint, there's a lot of different areas that you could audit against. And sometimes it is a physician, or sometimes it's what they call APPs or NPPs, as Medicare likes to call them, where they can be physical therapists, they can be audiologists, right? There can be the nursing notes for infusion. And so a lot of it also depends on the focus. We're talking a lot about sample, focus, risk, and all of that good stuff. But now auditing has expanded, right? Now that we've introduced this component of technology into the mix, we're doing audits at our firm where we're focused on automating the algorithm of the technology itself, which is interesting. That was something that we never thought we would be doing before, but we are. We use our coding skills to audit things like impossible days, right? Where you're not necessarily focused on a provider, but you're focused on whether the amount of services that provider billed could reasonably be performed on that particular day. We're also auditing things associated with the charge description master, right? You go in and validate whether the codes in the charge description master are correct. So coders, I really enjoy coding. I love mentoring coders, because there's a lot of opportunities that I think when you're first coming into the field that you only see one street for, but there's many different ways in which you can utilize your skill sets and how it could really contribute to making the organization a better place. In harmony with that, I've also seen auditing performed on what I like to call the enhancement side. Now, some organizations don't like to use that word. They use revenue integrity. They use optimization, whatever you're calling it. It's a way of identifying where you're leaving money on the table. That's a valuable skill, right? Being able to go in and assess a record and say, hey, this is what you billed, but this was what was performed, and here's what you missed. That is a huge asset for organizations today. And I know when I was coming up and learning my compliance background, that's not what we looked at, right? But then I started to see the value in when you're a great coder or auditor, rather, you can see it in both directions, right? So I think there's a lot of opportunity for auditors to sort of spread their wings and to see auditing from a multifaceted perspective.
Anything to add to that, Caitlin?
Not really. I think I've talked. I think I've talked a little bit about some other different types of audit, because Leslie, I'm like you. I've audited billers. Every piece of the revenue cycle needs to be audited some way.
Most definitely.
You make sure, I actually had coders once before that they weren't meeting their productivity standard. So I had to audit their time, like, because the EHR that we use would show us how long each person was inside that chart. Yep. And if they weren't doing stuff, it showed me everything that they were doing. Hey, what was what was going on. So especially those people who are hourly, those were the people that we had to audit from time to time just to make sure that they were,
Mm-hmm.
that they weren't distracted doing things, especially since a lot of us are now all remote. We can't really see
Mm-hmm.
what's going on. So I've had to audit, how long, productivity altogether. I've seen insurances pull provider schedules and see how long they were inside of working on a patient's chart to make sure,
Mm-hmm.
like Leslie said, make sure that they actually were able to, they actually did everything that they said that they did.
Yep.
And it's, there's so many more things that you can audit. It's not limited to just,
Mm-hmm.
what we're talking about today. There's so many different avenues you can go into.
Yeah, I've been involved in an audit where all they wanted to make sure that every surgery had a consent. That's all they cared about. They didn't care about CBD codes. They just want to make sure that does this person consent to the surgery, because that's where we're finding problems.
Mm-hmm.
So a lot goes with that. If it's Medicare, there's the ABNs. So there's a consent for many things. For treatment, financial obligations, the right to have somebody call your house if there's any issues, like all the consents. They will make sure everything was covered. So there's all kinds of different audits we can do. The main ones, again, that we see typically are the ones for CPT codes and diagnosis codes. But there's a lot out there that we are trained to understand, that we can use our historical knowledge to walk through and and find mistakes, or find leaks, plug the leaky holes. That's pretty much the whole purpose of auditing, is to find errors and find ways to fix them. So this is a question for Caitlin, because she's been auditing for a while, but she's been historically an E&M coder, and actually she used to work for AAPC as one of their analysts. So auditing, when you went ahead first in auditing, was there anything that when you started you thought to yourself, I wish I would have kind of prepared better in blank? What are some things that you wish you could have learned before you began auditing, or would be helpful when you start your journey?
I wish I would have taken med term and anatomy more seriously. I didn't think when I was going to school, when I was taking my classes, and I'm trying to be very raw here. I'm trying to be very, very, very honest here. I was like, I'm not touching patients. I'm not doing that. This has nothing to do with me. And I get into my job and I'm like, oh, this has everything to do with me. I have no idea what I'm looking at. So because there were times where I'm like, what is that? How does that even mean that? And it's because it's like, oh, that don't even sound like elbow. Like, what does that mean? And so I wish I would have taken those classes more seriously, and I wish I would have taken a physiology class. I think now, I've been very lucky in my career. I have a lot of providers who have really invested time in me and invested, helped me understand, disease processes and why things, why things progress the way that they do. Being in family practice, I'm kind of a jack of all trades, master of none. I have exposure to just a little bit of everything. And I think that's probably one of the harder things about family med versus a specialty, because when you're in a specialty, you really learn those conditions. And sometimes, especially, going back to talking about guidelines, when you have to know those guidelines for every single section and know them well in order to audit well, it's a lot. So I'm going to say I wish I would have paid way more attention and wasn't as relaxed as far as my anatomy and med term goes.
How about you? Are there any areas that you see, Leslie, that you want auditors to have some kind of advanced knowledge of, or you see as helpful when they begin?
Yeah. Well, I've got a couple. So anatomy and physiology is one for sure, right? Because I'm a coding instructor, I know the value. You can't move forward unless you really understand disease process terminology. It's just an essential part of coding. And no, we're not physicians, as you mentioned, but there's still a level of understanding that we have to understand and have to continue to learn. One of the things that I wish auditors would take the role on of is taking more initiative. Like, you don't get the information one time and you sit on it. You have to continuously learn. You still need your med term books. You still need your A&P books. You still need a medical dictionary. You still need to go back and look at those diagrams in your CPT books. They're really important. One of the other things I think that we look for with our auditors, because what a lot of auditors fail to understand is that they also become educators too, right? And so what I try to sort of just infuse into folks that I mentor is, hey, practice public speaking. Get comfortable with being confident in who you are and your voice and the way that you deliver your findings to another individual. Because when you're an auditor, it doesn't matter. You could be called into a board meeting one day to explain your findings. You could be called to sit in front of the Department of Justice. You could be called to sit in front of your CEO to explain your findings. And I think auditors have to be more equipped with the ability to present their findings to various different individuals in a more effective manner. The other thing that I wish auditors would really focus on is the art of summarizing your findings, right? Summarizing your findings in a way, because we preach all the time to physicians about, hey, your documentation needs to be clear, concise. I need to know what happened during that encounter without having to come and talk to you about it. And I say the same thing to our auditors all of the time. Your audit findings, your audit summary has to be structured in a way that anybody walking in could determine what you audited, your focus, your objective, your sample size, and what the outcome is, right? And so I think those things sort of take a back seat because we're so focused on the content, right? On what we need to know in order to be a great auditor, which is important. But then there's this other really important factor that rounds all of this out with a nice bow. So those are really three things for me, because one thing that coders who become auditors or auditors who just start out or auditors need to know about this business is it's continuous learning. You're never going to master it, so to speak, right? And it drives me nuts when I meet auditors who think they have mastered auditing. You will never master it. As long as there's regulation and coding guidelines, just have a seat for me. So I think those things are more important. Rounding out those essential skills that make auditors great is what we need to really focus on.
And I'd like to add, I have this really unique talent of playing stupid, and it works to my benefit.
Yes.
Because you're educating a provider, you're reading their note verbatim, and you're turning their own words back at them. So if you're constantly taking the the standpoint, well, I don't understand what you wrote. Can you explain it to me a little better? Can you clarify? And every time they answer, I say, put that in your note. That's what I want to hear.
Yep.
And
yep.
It's believable. I can be believable stupid, but then I turn around. So like that's one of my tricks out of my book. Here comes this really dopey looking dude asking questions, and sometimes they don't catch on until you're like, gotcha. As we want to see, the whole clarity thing. So like when I've seen a lot of R's that come in strong in the education sessions, which after an audit usually you have to talk about your findings. You go toe to toe with a doctor, intellectually you're gonna lose, because they don't like that. No offense to any doctors, but like it's part of their persona, like that they have to be on top of their game. So like if you make it a battle of wits, either A, they're going to close their mind and not listen to you. But if you trick them into like explaining, which they love to do, then you can use that as a teaching point. You just tell yourself what we want to see in your note.
Yep. Well, I say this too. It's interesting that you say this because I say this all the time. You gotta get comfortable with being rejected. Like most physicians don't want to hear what you have to say most of the time anyway, right? And I think for some people, they come in and it's an ego battle for them, right? They have some, background, childhood, something that happened to them that they're now bringing into the present and has nothing to do with anything that's happening. It's simple. You are a messenger. You are delivering a rule or a reg for a particular purpose. And your job is to ensure that they understand it effectively. Once that job is complete, you as an auditor or coder, you need to stay in your lane. It's a slide that I share when we educate auditors and coders. Even when we educate physicians, we tell them we have a lane, just like you. We can't go into the operating room. We can't go in with you when you're performing an E&M visit and tell you what to do. So we stay in our lane. We stay in our lane with our books and our tools and our guidelines and our resources, and we get comfortable with the environment. I think one of the things that's very important for auditors to learn how to do is not to become defensive, right? Because you need to move on to the next audit. There's another thing happening, and there's always a staircase or a hierarchy that handles those physicians that are just completely non-compliant, right? That's why you have compliance offices. This is why you have operational directors and managers and CEOs to handle that stuff. So it's really about what is your lane, what is the objective, and what am I here to do, and have I done so effectively? Is the question that I always ask.
All right, so let's get into some more routine stuff, but actually, let's get into some crazy stories. So auditing can be mundane, but sometimes we see some really crazy stuff. Let's hear some very HIPAA compliant, crazy stories. Like, what is some of the most outrageous thing you've ever come across in your travels?
I've got one. It's actually quite funny. So we were doing this audit one time, and I had auditors reporting to me, and they were saying, like, there's a doctor, and he said he is billing by time for E&M visits. It was something nuts. It was like probably like close to 17 hours a day, right? And so I was like, there's no way possible. That must be a mistake. But it just so happened that this particular physician's office faced the parking lot. Now, they worked a lot of hours, but the way they would count for time, it was all sorts of outrageous things in there. They would count. This is well before the new E&M guidelines came out, and they allowed all these new activities to be included. So he would count, he or she will say they would count for time like entering into the EMR, which wasn't allowed at that time. All these non-face-to-face activities, time they spent at lunch, and they were documenting while eating. It was insane. But the most interesting aspect was the way in which they were counting the time when they saw the patient face-to-face. So because their office faced the parking lot, what they would do is every time they saw their patient come in, they would start counting from the time the patient closed the door. Because according to them, they were assessing gaits, and they were assessing all of the things that can be identified in the physical exam component. It was hilarious to me. I thought it was the funniest thing I've ever heard in my life. And it was interesting. And that was just one of the crazy stories that I had. Another interesting case that I was privy to is one where, primary care exception, if you ever heard of this, where the modifier GE and GC, GE allows a supervising attending to supervise 4 residents, right, in a hospital setting under a primary care exception clinic. And so their role is to be there on site, intervene if anything goes wrong. So that means they can't be down the street, they can't be in Dunkin' Donuts, they can't be in Hawaii, they have to be on site. But it just so happens that this particular practitioner was going through a very nasty divorce, and their spouse had hired a private investigator. And that private investigator was following that individual and did identify that they were not actually on the premises as they had indicated by way of their supervision. So when that was reported, because this particular spouse was out with a vendetta. I did report that to the hospital, and we were able to identify some supervisory issues related to GE and GC. So yeah, some very interesting. Those are just two. I can go on for days, but Caitlin, I know you have a bunch. But those are just two that really just blew my mind. One, I mean, technically that spouse participated in our compliance auditing, which was wonderful, because there's probably, unless we popped up, which I do recommend doing when it comes to some of those supervision aspects, like for incident 2 and the primary care exception clinics, to make sure that you are completely complying with the rules and regs, because a lot of patients, believe it or not, actually become whistleblowers because you think they don't know the rules, but they do know the rules, and they're the ones going to the federal government about some of these supervisory issues. It's really important for you to create innovative ways, whether it's by way of your compliance department or by way of your revenue integrity, whatever it is, to ensure that these are happening. So just some interesting stories for you there.
I don't have any that good. I don't know how to follow that one, to be honest.
All right. I'll do one real quick while she thinks. Well, for those of you who know me, I'm only surgical. I hate E&M with passion, but
I love it.
There was one surgeon that his documentation standard was, and this is his narrative. Okay, came in, patient was put on the table. I did the surgery, sent the patient to the PACU.
Okay.
Yeah, that's it. I came, I saw, I coded. No idea what surgery the person did, but there was a code selected. That was a tough one, because I don't know how to tell you what you need to document, because I don't know what you did in the first place.
I had providers at a clinic that they didn't want to charge office procedures to their patients, so they would document just enough so that we know that they did something, but not enough for us to bill it, because they didn't want to charge their patients.
Yeah,
they're like that. Their standpoint was they came in to see me. Everything that I do should be included in that price.
That's an interesting. I always talk to, from a compliance standpoint, I always talk to providers about the danger of that, because it can fall under Stark when it comes to providing a service for lesser value. Even if it's coding less, it can be looked at as an inducement when it comes to federal beneficiaries. So yeah, that's such a dangerous. And then they say it out loud, or they put it in an email.
Yeah, that practice manager got tired of saying my name. I can say that. I can say that confidently. Sure. Dr. So-and-so said this to me today. I do have a good one. When I was pregnant with my babyest one, my little Johnny Knoxville, I've the second one. That's all I'm gonna say. It was when the 21 guidelines came out. I had a specialist call and curse me out because they didn't apply to consults. The new time guidelines and the new E&M guidelines didn't apply to consults. It was my fault.
Oh wow.
And I said, I understand that you're upset. But if I was able to control that, I would not be here. So I would not be the person you're talking to. But that was that one was fun. I'd say y'all probably, Leslie, did you do primary E&M, or are you more surgery auditing?
I've touched everything. I've touched everything from DRG validation to professional. Yeah, I've touched a lot of it.
So I used to, whenever I was auditing E&M back when 95, 97 guidelines were, that's when we were in effect. I always had issues with, I would always had to down code new patient visits because they would document what was needed for an established for that level. But they
Mhm.
would, so whatever you needed for an established, you needed to go one up for a new patient. And they would document based off of established level guidelines. Like for a level 4, they would document, um, moderate, the I can't even.
The severity, the moderate level
Yeah,
severity. Mhm.
yeah, they would document the the moderate MDM 5 to 7 organ systems and or body areas, and then my brain is blanking because it's straightforward, low.
Moderate and high.
So okay, so moderate was okay. I thought it was
Yep.
something different for like the history and exam components. I thought it was something different.
No.
My my brain is short
There
circuiting.
were for the history and exam, there were different ones.
Okay, so my brain is short circuiting and I can't remember, which is crazy because I had to do so much provider education. I knew the 95 and 97 guidelines. I knew every page in the CMS handbook, like when each component was going over. So if you would go to page 8, you would see where we go over the review of systems. And
Mhm.
while most payers don't like it, CMS states provider documents, a system's positive or adopted in HPI, all others are negatives. We have to accept a comprehensive was the last one. But I can't remember the level 4 version, whatever it is. My head's not letting me.
Well, I guess that's a positive selling point for people that want to take auditing. You don't have to worry about the 95 and 97 guidelines anymore.
That's when
Unless
I took
you-
my E&M exam with the
yeah.
95.
So for those that don't know what the 95, 97 are, it's when we had to count the HPI, the review of systems, and the exam, and all the social history.
Histories.
Where
We
to
had to
get the level.
quantify all of it.
That took forever. Auditing just takes so much longer because we had to count them. And it was a lot of administrative, basic nonsense. It was what they used to call it was there was a term for it. It was called a documentation for dollars.
Mhm.
Well,
Yep.
new guidelines have kind of cut that away, the administrative burden of it. So it's a little easier. Auditing is a little easier nowadays. But there's always there's give and take, because we don't have to count the history in the exam any longer. We want your plan of care and your assessment to be a little better. So that's what the aim is now. So let's talk about mindset, because auditing takes a very specific kind of personality. If you're picking things apart day in and day out, what do you two typically see as like some personality traits that you have to have, and what are some killers? What are the ones that really ruin? Like, what are some personality traits that kind of slow you down?
Someone who's good at auditing can't be okay with half doing it. You have to be very thorough, very meticulous. You can't just I did enough, and I did the things. You can't be a bare minimum person and be an auditor. I'm sorry, the two cannot coexist.
Yeah, I would agree. You have to be very detail oriented. You have to be very thorough. You do have to be very inquisitive, right? You have to ask a lot of questions. I think you have to be very patient. It makes me very uneasy when people are looking for, overnight outcomes. Sometimes audits take time, especially because, I know from a consulting standpoint, we are somewhat described as heartless and cold, but majority of the folks that work for us at Review Healthcare have worked in a healthcare setting at some point, right? And so you do understand a big component to auditing is understanding the way in which the process works and flows, because oftentimes the aha moment on why you're identifying risk has to do with the way in which the process is happening. So it does take time to ask questions and to be patient. And I also think that it's really important for auditors to be continuous learners. I think there is a huge I think people get this confused, right? I have a very confident aura, right? It doesn't mean that I'm being condescending or I'm coming in saying I'm better than you. But it's an aura that states clearly, I know where to go, I know what I'm talking about, and I feel confident in what I'm saying. But within that, I never want that to be the driving force in the way in which I effectively communicate. So I think one of the things that is really important for auditors to do is to learn how to become students when it comes to, and also be active listeners, right? That means being quiet, listening to what the other person has to say, listening to their perspective, listening to their approach, so that you can better understand how to help them in the end when the audit is over and throughout the process. And so I think it's learning how to balance confidence with humility, and inserting active listening in the middle is a really, really important part. And we do assess that in interviews, whether you're actually a good listener or you're just a person who walks in with all coding books, slams them on the table and says, I know everything. Well, I don't want to work with you. No, thank you. I'm okay. So yeah, that would be my take on the matter.
Leslie, I'm going to piggyback off something that you said. So because I was thinking continuous learners. Yes, I think some people fall out of that, especially when they go into the corporate setting of things, because most higher ups think that once you obtain your certification, you're done, and so they're like, oh, you can do all the things, you know the things. I'm not going to pay for you to get additional education because you have you have the certification. You've proved to me that you can do it.
Yeah.
And I think it's getting into, we're so, hey, I really want to go to this conference so I can learn these things. Can you help reimburse me to go so I can bring this back, and I can,
Sure.
I can educate the team. It makes me a better auditor. Can you help invest in me, and invest in me some? And like I said, I think, again, once you've passed the thing, some of it is, verse out like, oh, I can do this. You have some of those. You have some of those, absolutely.
No,
But
absolutely.
yeah, but I mean, it's, a lot of the times you get, in one of my previous employers, I paid for I paid for most of my certifications by myself. I paid for my bachelor's by myself, and nobody else invested in me. And so, like, if I want, I did this solely because I wanted to. I had no, I didn't have a whole lot of backing as far as.
Sure.
And so
no, I was going to add to that. That's understandable. In fact, I've actually told a lot of new coders, but coders who are out there in the market, I don't care if you're established, new, whatever the case may be, you want to ask those questions during interview, right? So going to conferences and investing in, not paying for like degrees and other things are a little bit different, right? But when it comes to investing into my continuous learning, I tell them, if during interview you ask the question, am I allowed to, as a coder, this is part of my job description, to stay abreast of all the regulatory changes. Am I allowed to go to 2 coding conferences a year maximum? And that includes also contributing to my CEUs, even if it's just maybe half of what is due. If they say no, run, right? Because part of the job description is keeping abreast, keeping that certification, maintaining quality standards, and you can't do that without education. You just can't. So you have to be really intentional. I think especially now, as a lot of hospitals are tightening their belts, but they still want the same outcomes. You have to kind of push back and ask them, hey, listen, this is really important for me being successful, right? So is there money in the budget for this? And how can we make that happen? And what can we put in there? That's a really important part. And coders shouldn't wait till they get hired. Auditors shouldn't wait till they get hired to ask those questions. Those questions should be happening during interview.
So whenever the hospital that I work for currently, I told them, I said, listen, I speak at conferences. I need you to be okay that I'm going to be at least 3 or 4 per year. So, but at the same time, I'm going to all of the sessions. I'm getting education, and I have to have these educations for my certification. And I'm going to take a different approach. I'm going to say getting degrees is continuing education. It's for me, my bachelor's is in health informatics. So I had got an additional understanding of electronic health records, interoperability, which is crucial, especially whenever I'm having to work closely with our Epic trainers to create, to create smart phrases and things of that sort. For me, I feel like, especially the roles that I'm trying to take on,
right? That's important. That's a really important part to highlight. It's what is the role that you are looking to take on and what is necessary for that role. And I think a lot of people miss the opportunity to really assess that and determine what is really reasonable for your employer. Because now, me being an employer, I understand reasonableness, right? Because I can't pay for everybody's bachelor's degree. I can't pay for everybody's master's degree. I want everybody to have it. But what is reasonable in order to get the job done? And how can I assess that as an individual so that I can ask that of my employer? I think, and the role that I have is really, really important.
Right. I think, there's, I agree. There's no possible way to cover, to cover everybody's. I think when you pose it as what is the benefit to the organization for me, to do these things, it can't be just, I want to go do this and I'm going to ask you to pay for it. What is the return on investment for everyone involved? Right. Sorry, John. I feel like I kind of took that question. Away. No, I'm looking into my master's right now, so that's
the whole purpose of these interviews that we do is to kind of to encourage people, because there's so much out there, and finding your niche, finding your track where you want to be is really why we do these. So the more information out there that we can give to people is really all for the good of humankind. To put it, but we have another question, and it looks like Carlita Johnson may have gotten a hold of my question list because she asked the next one on the list. So it's actually about resources and about tools. So let me bring it up here and have her asking. Let me find here. Where was that one? Yes. So favorite auditing tools and references. So what are some tools that you need to have a handle on or be able to use when you audit?
So I'm old school, right? I came up in the all book era. You weren't a real coder if you couldn't code out the books. I came up. That's the era I came up in. I know I look like I'm 8, but that's how I came up. What I would recommend are two things. They have so many great, and just a little shout out to AAPC, because I work on a couple of committees with them, and they've got some great technology coming by way of Codify and some other software that's really great when it comes to auditing and being able to use it. But I think one of the things that are really essential for auditors to have, because the CPT book has code descriptions, but it doesn't go into the minutia of what is included in that description sometimes, right? And I think it's really important from an auditing standpoint for you to have a software tool or some sort of CPT desk reference. And there are quite a few resources out there via Optum and some other, I'm sure there's some other, folks, brands out there that have that serve the same purpose. But I think that's really important for auditors to have, right? Especially if you're auditing CPT codes, whether you're doing on the professional side, technical side, whether for E&M, surgical, diagnostic, doesn't matter, right? This desk reference, I still buy the book to this day because I need to just feel a book. But then they also have these really great add-ons by way of Codify that can help you sort of digest down, get examples. There's even educational tips in there. And if you have not invested in it, it's great and you should do it. Electronically, it's really awesome. It's simple to use. We use it at our firm. It keeps us sharp. It helps, especially if you're doing anything independent consulting, right? This is important because there's a lot of people, I cannot stress this enough. There's a lot of people going off into independent consultancies, and I'm all for it. I'm a small business owner. I'm a woman in business, so I'm for it. But one of the things that takes away from the quality of the overall industry, right? When it comes to consulting, is when reputationally you put yourself and the information you're providing at risk by not using the appropriate resources. So Codify through AAPC, they have monthly fees, right? If you have to pay for it on your own, it's reasonable, it's affordable, it's something that you can also position to your job to show them the benefit. There's the NCCI edit tool, there's the LCDs, there's newsletters. I mean, you really should have a tool. And then there's other great organizations like Optum who have encoders. You've got 3M. I think they're doing some really cool stuff with some standalone web-based encoders that'll be really, really helpful. That I know that's more geared to like inpatient coding and DRG validation, all that good stuff. But there's a lot of tools, and what you really want to research, it's something that we practice all the time. And I think even whether you have your own business or not, there's a lot of things that you should be practicing now that can help you really show value to your employer. So even putting all of this information side by side in a spreadsheet and giving it to your boss and saying, all right, look at all the benefits. This is how much it costs, and this is where it's going to benefit us when it comes to our organization and the risk and the way in which we audit. So yeah, there's so many. I can go on forever about this because I'm always fascinated when people do not have these tools. But yeah, there's a lot of resources out there.
Okay, well, what are some of your go-to tools and references?
I'm gonna have to second Leslie on Codify. So those of you all who don't know, I used to work on Codify. So I used to work on all the Codify updates and things of that sort. I've actually built some of the tools in Codify. One is actually coming here soon, hopefully. So I would say have you a good solid encoder of some sort.
Mm-hmm.
One that's that is accurate. Also take some of the information that you have to be knowledgeable on what information comes from authoritative sources versus information that's created, and that's for any kind of newsletter, listservs, any kind of tool that you use. Make sure that you understand the difference between what's true regulatory guidance, what you can actually use versus, Leslie, when you used your example, the book of somebody else.
Yep.
So make sure that you understand those differences. I'm going to say, as an auditor, one of the best tools that you can have is a mentor. Have someone who can guide you on, I usually take in people who are newer into the industry, and we talk about, okay, where do you want to go ultimately? What do you want to do? If you want to learn how to audit, evaluation, and management, you can come my way. We'll sit and we'll talk. We'll look at, I'll pull up my chart and we'll look at some of my chart notes and we'll talk through those. I will do that. But if you're wanting surgery, I'm the last person you want to talk to. I will be the first person to tell you I'm the last person you want to talk to. But I know people like John, like Leslie, like, again, depending on the specialty. I think I saw somebody ask how you choose what specialty you want to go into. I think most of the time the specialty chooses you. Because most of the time you're applying for these auditing roles and you don't know what you're going to get into. Especially if you're, Leslie, I'm sure you all probably have some specialties. You have people grouped into some sort of specialty, but for the most part, most auditing entities are going to want someone multi-specialty, or you're willing to learn multiple specialties. We talked about being forever learners. One of the best tools that you can have is a mentor and your outlook. I would much rather have someone that knows absolutely nothing, that I can teach from the ground up, that's coachable, than someone who automatically thinks that they have it. So I think your attitude and having a mentor are two of the best tools that you can have. And if you're questioning, if you're like, hey, I found this, can I use it? Ask your mentor. If you don't have one, find one. You can, one of us will help you. If it's not something in our wheelhouse, let us help you. We'll find you. We'll put you in that, and we'll put you in the right direction. But again, I think I kind of went a long way around. But ultimately, best tool is a mentor and your attitude.
Good.
So auditing is one of the things with the AAPC where they have their own certification, and I think there's other groups out there that also offer certifications in other than the APC. Like I think one's called NAMAS.
Mm-hmm.
Well, let's talk about those certifications. So for the AAPC one, I know you have it and I have it. What can we say about that? Is it worthwhile to have and practice and getting into? Is it something that's an easily obtainable goal? Is it a worthwhile goal?
I'm gonna say this. It is very worthwhile depending on the job that you're going for. I think what I'm starting to see with certifications is that people are gathering them sort of like they collect coins, right? And they're serving no purpose. And I think for me coming up, each certification that I received served a purpose, whether it's for some sort of professional growth or whether it was increase in salary or whether it was learning something new. I think it's really important for medical auditors once they're in a medical auditing role to obtain that certification for sure. I love employers that say, "Hey, we'll give you 6 months to a year to get it, and we're going to give you this job because you meet the skill sets, you have the criteria, and all that good stuff." I think what the CPMA prepared me for personally was there was a lot of aspects that were not about content and more about sampling, methodology, right? And review findings. Who do I report this issue to? Which is really, really important stuff to know. But I do think there are a lot of elements that sit outside of the certification process that auditors need to really learn and focus on. What I'm trying to get newer folks who are coming in the industry to understand that the certification test is the entry point. And a lot of them, what I've been seeing, a lot of them treat that as the final outcome and they kind of close the book. And that is when you should be opening the book the most. The minute you have your certification, you pass. So I think the CPMA is essential for those folks that are truly going to audit. I think one of the reasons why, and you guys may have a different experience, but one of the reasons why it's so challenging now to find good coding auditors or good coders in general, it's because we live in a time right now where everyone's chasing something except what they are good at. And what it does, it oversaturates the market. It creates a lot of what appears to be overly experienced individuals when in fact what they need to do is find a lane. Like, what do you enjoy doing? What specialty do you like coding in? And go for it and do it. That's what I try to kind of guide my coders to. And sometimes people will send a thing like, "Oh, you're just trying to pigeonhole me." No, I'm actually trying to give you a foundation so that you can build upon that foundation, and then you'll be absolutely amazing. That's what I had to do in my career. So I think it's really, really important for auditors, when you're evaluating a certification. The CPMA is great, but that is the entry point, and there's so much more you need to learn. And to Caitlin's point earlier, you do need to position yourselves with a good mentor, absolutely, to help guide you through it.
All right, so we're winding down with the questions, but for people that are interested in auditing, where should they begin? Like, what are the ways they can kind of work their way into this field?
I wouldn't do it my way. Well, I started out in compliance. I jumped headfirst into compliance. I became a coding compliance auditor. I didn't really have this was almost, we're looking at 16 years ago. Didn't have a strong coding production background. So I took what I call the fishtail route, where you're just kind of swimming through and you learn as you go. And it was a great experience. But I do think that auditors who can take on entry-level positions where they're focused on one type of audit in one specialty helps you to build, like I talked about before, the structure and the foundation to be great. I think going into, if you're a new auditor and you apply for a job and they're like, you're going to be auditing cardiology and, gastroenterology, don't do it. Don't do it to yourself. It's too early. It's too soon. It's too fast. Get control of one specialty. Evaluation management is a great one to do. There's so many different ways you can go with that. And then just build upon that. It's great from an entry level perspective.
How about you, Kaylin?
I have to say auditing kind of fell into my lap. When I got started in this industry, I started off in billing, and then I passed my CPC exam and got switched into coding. And I was very lucky. I had a coding lead. It was her and I became close because our sons were in the same daycare class at the hospital I worked for had a daycare, and she really took the time, and she said, Caitlin, she said, I want to teach you how to audit E&M because she said, I know you're wanting to get into a lead position. She said that they won't even look at you if you can't audit. She said, E&M is one of the hardest things for people to grasp. And it seems so easy, but there's so much gray with E&M. But she said, I want to take you and I want to teach you how to do this. And she would carve out 2 hours out of my production time. She would reassign some of my coding assignments so she could teach me how to audit, evaluation, and management. Her name's Kelly Clark. She was wonderful. And I have so much I thank her so much because she took me on, and she was like, she said, I want to teach you how to audit E&M. And so it just so happened, I got really close to our coding educator who would educate our providers, and I would ask her, can I go with you so I understand what you're explaining to my providers? Yes. And she actually printed me out her full packet. Her name's Mary Berendis. She was incredible. And like just the wealth of knowledge that these two ladies had was insane. And then our supervisor, her name was Donna, and she let them grow me, and she also continued to grow me. And I remember Donna told me one day, she said, Caitlin, she said, I know I'm not going to have you for a long time. She said, because you're destined for great things. She said, but I'm going to grow you as long as I can while I have you. She said, please be patient with me and let me do that. Because I was one of those, I'm ready. I'm like, put me in coach. Like I'm ready. I was also in my 20s. So I was like, put me in, I'm ready. And I'm not very good at being patient. Those of you who know me also know that very well. Some things never change, but I would go with her and she would explain, and that's how I learned every page of the CMS handbook. I understood all of the documentation requirements to me. So that was how I got into auditing, and I actually developed our audit plan for E&Ms at a previous employer that I worked at, because I worked so closely with them and understanding how to perform these. I was like, hey, our process right now is not standardized. We need a standardized process for this to be a true audit. We can't just, that's an easy audit for me to do, and just that we have to have some sort of standardized process. And so I kind of got into auditing in a little bit of a different way. It kind of fell into my lap. If you have those people that say, hey, they volunteer to be your mentor because they see that you have great things coming, let them. If they're going to invest their time, take it in. Don't take their time for granted, because they're going to quit. The people who volunteer to mentor you, very hard to come by. Let them do it.
And I want to add to that, if from personal experience, if you find somebody that's willing to set aside time for you, take them up on it.
Mm-hmm.
Don't let that slip. Because that might not happen again. If you find somebody that's still available to help you, take advantage of that opportunity, because in this industry, like, there's a lot of new coders out there, and the ones that are experienced, sometimes are really preoccupied. So if they are available, that's like the unicorn. Take it for a spin. and get as much as you can out of it, as often as you can, because it's helpful. Like one of the, and I keep pointing back to the reason for these episodes is like there's a huge gap between all the new coders entering the market and all the experienced coders. I'm trying to like lessen that gap. So there's a lot of people out there that do the same thing. Leslie, Caitlin, there's so many names out there. Just find your person is going to be key to that in any field you're in, not just auditing. All right, I'm putting my soapbox away. All right, so we've been on this an hour and a half, hour and 20 minutes. I'm sorry, numbers are hard. But are there any last minute comments or questions that you guys want to discuss, or things that I neglected to talk about? Because if you don't bring them up now at 3 a.m. when I wake up, I'll be like, I did forget to talk about this, and it'll really ruin my day.
The only closing thoughts that I have is I am a little afraid for the industry right now with the amount of people migrating into the fields without mentors or without direction. And so I am strongly encouraging anyone who is on today, whether it's YouTube or LinkedIn, wherever you're on, to reach out to someone. You don't even have to ask someone to formally mentor you. You can have virtual coffee with someone and pick their brain, hear about their journey, tell them what you're thinking. And, most of us have had that. I've had some amazing mentors that have guided me along the way, that has really helped me get to the point that I am now, where I had the confidence, for my partner and I to start our own firm. That took a lot of mentoring. That didn't happen overnight. It took actually 15 years to get there, to make that decision. So I am really concerned with the amount of individuals who are jumping in the field because they see it as an opportunity and nothing more. And I just think that there needs to be more intentionality as to what you're doing, why you're doing it, in the direction that you're going. And keep in mind, you may have gotten your certification through the AAPC or HEMA, but there are so many other organizations out there with so many amazing, amazing people, like Healthcare Financial Management Association. There's NARI, there is AHIA, there's Healthcare Compliance Association. There's so many different types of organizations and ways in which you can obtain mentors or folks that can help guide you. So yeah, I strongly encourage that.
I'm going to say my main takeaways is auditing is a very it's a very interesting career avenue to go through. And if that's something that you're interested in, maybe just maybe sit and see if you can watch it, see if you can like watch an auditor or something, watch their workflow, see if it's almost like job shadowing, like we did, like you did in school. Make sure that that's something that you're interested in, and this career field in general. If there's a direction you want to go in, have that virtual coffee. I used to do virtual lunches all the time. And talk with the person, because you want to talk to someone who is either where you are or has been where you want to go, and have those conversations. Let active listening. Start preparing yourself for that auditor mindset of how you need to be whenever you're when you're receiving education, you're giving it back. Go ahead and start embodying what that role means, and you'll say the right opportunity will come to you. Just again, take in all the information that you can get and find the best way that you can apply it, and this career field will have a lot to offer you.
All right, so it looks like we had a great conversation today. This auditing is such a huge topic. We're gonna have to do this again because there's so many different variations. I want to try to find something. This might take a while, so I want to find an auditor that just codes for that only codes for the pancreas. Because they're out there. Just to show how niche it is. There was a question like I think it was Carla asked a question about finding their niche. And that's okay because there's, like we said, there's auditors for claims, there's auditors for denial, there's auditors for administrative tools. People that can read an ABN with their eyes shut. Just knowing the ins and outs of that. Like you can, if you're the one expert on ABNs, I'm sure you can make Mad Bank as an auditor because I'm sure that's one of the key things that like the OIG looks at. Oh, there's no ABN. Tough luck. You figure it out because you need that. So like again, there's so many different variations, and if you can kind of learn one area really well, you should be able to audit it really well. It's not a good area to say, I know every medical specialty and I can audit every medical specialty because it's unrealistic. So realistic goals, I think, is one of the things that I think you should have. Pick something and stick with it. Me, I was the one that tried everything before I actually landed on the one thing that I actually do like. And then, there's some certifications that I got that I don't do anything with because I don't have a need to. So again, it's all about what you really enjoy. And, kind of experiment because the last thing you want to do is become an auditor in something really well and you hate it. Nothing ruins your vibe or your productivity by doing something you hate. Yes. And again, one of the reasons of the episodes is to find out what you like, and because if you don't, you're stuck with it until you learn something else. All right, but that's it. I'd like to thank Leslie Bowles and Caitlin for coming and talking to us today. Next week we're going to have an episode, I believe, on wound care. So that's going to be interesting. So again, not for the faint of heart, but I hope to see you all next week.
Thank you so much,
everyone. Thank you.
Have a good night, everybody.